Well, good afternoon, and thank you for joining us here for Doing Justice and Loving Mercy, where we're going to be talking about the work of Adventist health in our communities. I'm Steve Allred, and with me is Judy Leach. Hi, Judy. How are you today?
I'm doing well. Thank you for having me.
It's really good to have you. And I, of course, work with the Church State Council and Government Relations. Judy, you work with Adventist Health as a government relations executive. Tell our viewers a little bit about yourself and some of the work you've done in the past, as well as what you're doing now.
Thank you, Steve. It is an honor to be able to talk about the work of serving our communities and the work that we do together. The Adventist Church, Adventist Health, our partners, our communities. Being in this work together is life transforming.
Hmm.
I have been in healthcare most of my life, began that journey when I was working in the broadcast industry. And I happened to be assigned healthcare. Now, I come from a family of many physicians, and I always said, there's got to be more to life than healthcare. But when I was asked to serve in that capacity for stories that really focused on the difference that quality care makes, they said, okay, Judy, let's dive into this. And then as I was doing that, an Advent Health hospital happened to see that story and asked me to join them. So between Advent Health and Adventist Health, I've been in this for more than 25 years.
You couldn't get away from healthcare even if you tried. So,
And I did try.
well, I'm really glad that that we've connected because, and actually, I think you reached out to begin with to say, hey, let's get together and talk. Because what's been neat is I've visited with government officials and their staff over the few months that I've been in this work. Whenever I bring up Adventist health, people are always there's a positive reaction, and so I think it's such a good work that you folks are doing, and I appreciate you and specifically the work that you're doing, and I think it's a good opportunity today to just talk about some of the specific things that Adventist Health is doing in the community, specifically because obviously we think of hospitals, we think of sick people and the emergency room and the medical care that's given, but I think what a lot of people don't realize is just kind of the broader benefits of these hospitals and clinics and the things that are actually helping the community in ways that are not often talked about. So, I think, Judy, to begin with, you and I are both Christians. Adventist Health is a Christian and Adventist organization. And I want to ask you, and maybe it's kind of an obvious answer to some people, but let's talk about it. Why should followers of Jesus care about making the world a better place? Especially Adventists. I mean, the very name means we're looking forward to the Advent, right? When Jesus is going to come back, and we believe he'll end history as we know it, and recreate the earth, take us to heaven, all that good stuff, right? So why care about the world now? Why care about our physical world and our fellow human beings, and specifically why care about our communities and our healthcare in our communities?
Jesus called us to love. And when I think about the power of that message, in order to love our neighbors as ourselves,
Mm-hmm.
in order to do good in this world, it is not a choice that we have. It is a sacred calling. And I love to think of the work that we do as a sacred calling, the ability for us to take care of the needs of each other, the needs in whole person care, which we refer to as mind, body, and spirit.
Mm.
And so as a Christian, I often think of, why was I placed on this earth? I feel like we were all placed on this earth to make this world a better place. I'm a third generation Adventist. I was born in India. My grandfather was a pastor. And a really interesting story, he was not raised as an Adventist, he was raised as a Syrian Christian. My grandmother was raised as a Hindu. And together they found each other at an Adventist university. They had one thing in common, came from very different caste systems, very different backgrounds, but they had one thing in common. They felt like their sacred calling was to do good in this world.
Mm-hmm.
And I feel like that legacy has just continued. And what an honor it is for me to get to see that work every day in our 27 hospitals across the Western United States. These are employees who realize that their sacred calling takes them beyond the bedside of a patient.
Mm-hmm.
And really, it's the work that happens in the communities with our neighbors, our friends, strangers, and those who we encounter in our rural communities, as well as places like East LA, where you've got this wide spectrum, a great swath of members who have burdens that we cannot even imagine, who are just trying to put one foot in front of another. And we're called to try to make a difference in their lives, not just when they're in our hospitals, but most importantly, those that are in our communities that we rub shoulders with or that we pass by every day.
Yeah. I love that. I mean, and what I hear you saying is that as we follow Jesus, we really can't help but want to spread his love to those around us. And that includes very practical things like the work that Adventist Health does. Judy, I think you have a slideshow that you want to show us that has some details about some of the work you do. And then we'll have some more conversation. I have a couple other questions for you, but would you like to go ahead and jump into that slideshow?
Let's get started. That'd be
Okay.
great. Thank you.
Let me, on the technical side, see if I can do this here. There we go. Okay.
There we go. Well, our opportunity today is to talk about the difference that is being made in the lives of those that we connect with every day. And Steve, the next slide really talks about our mission of living God's love by inspiring health, wholeness, and hope. It's not just words that appear on a plaque somewhere. You see the word living God's love. That's an actionable step. That's a very active mission statement because it's not pondering, it's not considering, it's not even being inspired by, but it's living God's love. And as we look at what that means, we go back to the world of antiquity. That next slide really talks about some of the predominant views of the world of antiquity of the Greco-Roman world. You know, this was that thinking of disease, a curse from God,
Mm-hmm.
that there was death as an escape, the difference of tribalism, the difference of racism. This was what we consider, I use the word belly button gazers. So if you think of that term, it's thinking more of ourselves than others. But that was the world of antiquity. And that next slide really talks about what that means as we look at the birthplace of Jesus. In a space of darkness where there was no hope, suffering, and hurt, this is where we find the birthplace of healthcare. It's what I would say is where Adventist Health has found our sacred calling. In a world where you're taught to only love yourself and those that look like you, Jesus comes into this world, and here he is on the scene, and he says, love is the core of all we do. It really is what has transformed human history. And the next slide really reminds us that our founding physician, Jesus of Nazareth, looks at the world with compassion. I come from a family filled with physicians, And I'm reminded every day of why they entered this sacred profession. And it really connects us back to Jesus' calling in our lives. As we look at what that means, that next slide, Steve, talks about when Jesus saw the crowds, he was moved with compassion because they were harnessed and they were harassed, they were helpless,
Hmm.
they were sheep without a shepherd, and we come in to help, being a harness to help inspire and bring them out of that captivity. The Greek word used for compassion in the book of Matthew translates to a literal pain in the stomach or a gut, one that makes you move with action. That's what Jesus' compassion did.
Hmm.
That's what it continues to do this day. The next slide really talks about someone that I'm very inspired with. This is Rodney Stark from the University of California at Berkeley. He's a historian, and he talks about the fact that the Jesus community, it
Mm-hmm.
arose as a revitalization movement in response to misery, chaos, fear, brutality in the life of the urban Greco world. Does that sound familiar to us today?
Mm-hmm.
Um,
Sure.
if we go back and connect the dots from that historic point of view, the next slide, the next several slides that we hear from Rodney Stark really do talk about what that looks like. So, Steve, he continues and he talks about the fact that the cities filled with homeless and impoverished, it's offered clarity as well as hope. Now, our mission statement calls us to live God's love by inspiring health, wholeness, and hope. The word hope is really powerful, I think.
Mm-hmm.
In fact, for me, it's my everything. It is my guiding light, and it is what allows me to wake up each day. But here we look at how important that hope is to cities filled with newcomers and strangers that offered as immediate basis for attachments. And he continues by talking about the cities filled with orphans and widows. For all of us, we know people in these categories, right? It provides new and expanded sense of family to cities torn by violent ethnic strife. Does that sound familiar to us today?
Mm-hmm.
It offered new social solidarity to cities faced with epidemics, fires, and earthquakes. For those of us on the West Coast, we can relate.
Sure.
It offered nursing services. And so this was a bit of history that Dr. Stark was taking us through, and we connect the dots to where we are today.
Mm-hmm.
So we go back to this text of Micah 6:8. What does the Lord require of you? To act justly and to love mercy and to walk humbly with your God. There's some key phrases here, or even key words that I pull out of this text. Steve, I think of the word, what does the Lord require?
Mm-hmm.
That's why I often say it's really non-negotiable. It's what he requires: to act justly, to love mercy, and to do it humbly.
Right.
That's our calling as well at Adventist Health.
I love that. Judy, let me jump in if I could. You said something earlier that I think it goes along with this verse. And we know about healthcare taking care of people's bodies, right? And even their minds. We have psychology and psychiatry and that type of thing. But I think the soul part is something unique to a religious organization like Adventist Health. And so the body, mind, and spirit or soul mentality is like you said, a whole person type of care. And I love that because this is what Jesus did when he came, right? He wasn't just taking care of people's physical needs, but also their spiritual needs. And Adventist Health, that is a part of your mission. And this is this mission to to love mercy, walk humbly, and to act justly.
Those phrases resonate with encounters that we have every day.
Mm-hmm.
They resonate with every person that we encounter, whether they're coming in through our emergency departments, our clinics, certainly those that might be facing immediate needs of surgical care. But just as important as that which happens within the walls of our hospital is that which we do outside the walls of our clinic and our hospital. And that's where I think this work of social justice is
Mm-hmm.
so important. I see social justice all over this scriptural text.
Mm-hmm.
It is the ability for us in healthcare to lean in and to do that which the Lord requires of us.
Absolutely. Yeah.
We are called to certain values within our organization. And Steve, this next slide really speaks to that. Our values, we sometimes refer to them as our B statements in Adventist Health, but
Mm-hmm.
it's to be love, it's to be welcoming, to be a force for good, to be curious, to be a mission owner, and to be brilliant. Those are not terms that just happen when we are at the bedside of a patient.
Mm-hmm.
Those are values that we hold dear because they connect with every part of our lives. And that first value, especially to be love, that's what I believe justice is about, is to demonstrate love with our community. We have our CEO, Carrie Heinrich, who says it really well. And let's see if we can show that video.
All right, we're going to add that in here and see if we can get that to work. So let's do that here.
We are Adventist Health.
We are Adventist Health.
We are Adventist Health.
Hi, I'm Carrie Heinrich, and I have the privilege of serving as Adventist Health's President and Chief Executive Officer. Adventist Health is a faith-based, not-for-profit, integrated health system serving more than 100 communities on the West Coast and Hawaii with over 440 clinics and 28 hospitals. Our heritage and organizational success are founded on the principles of the Seventh-day Adventist Church, which has long championed well-being, disease prevention, and whole-person care. Together, we welcome and serve every individual regardless of their personal beliefs. Our compassionate and talented team of more than 38,000 professionals is driven in pursuit of one mission: living God's love by inspiring health, wholeness, and hope.
And so, as Carrie Heinrich says, this is living our mission. These are actionable steps that we take every single day to live into our values, to do the right thing for those who we encounter. The next slide is really going to tell you a little bit about what that looks like, because every day at Adventist Health, we see over 9,000 people just in our clinics.
Wow.
There's over 1,300 patients
Mm-hmm.
that we care for within the halls of our hospital every single day. Every day, we go to the homes of more than 900 people to help meet their needs in their home settings. We're thrilled because every single day, over 50 babies are delivered.
Wow. That's
That
amazing.
help transform love and bring love into the world.
Mm-hmm.
The work of our 38,000 physicians, associates, and volunteers really is about living our mission. and the patients that are treated through our emergency departments. It's what I consider the front door of our hospitals, because these are community members who have had an encounter that they were probably not planning on that day.
Mm-hmm.
And we have an opportunity to lean in with love. We're so grateful to also be able to do some work with our universities. I'll use Pacific Union College as an example.
Okay.
We have a great partnership with PUC in that they are helping train local community members into the profession of nursing with us, so that we can lock arms together and say, let's go do good in this world by helping train community members who have a desire. And that training then happens in the communities where our hospitals exist, because not everybody can go off to a campus for that training. But at Adventist Health, we've said, let's do this together. Let's do this for members of our community that want to help impact doing good by their clinical excellence.
Mm-hmm. I like that.
You're seeing just a glimpse right now of what Adventist Health is as far as our priorities. I think our COO, Eric Stevens, says it very well. And Steve, in that video coming up, Eric will talk about the difference that we make in the communities that we serve.
Okay. You want to play that video now?
That'd be great.
Okay.
This is my most overt mission statement. Jesus' life on earth, he demonstrated an interest in people who fell beneath the interest of the ruling theocracy. You can't love somebody if you're not interested in them. So how can we create teams and systems that are deeply interested in the communities we serve, even in people who make a series of bad choices or who come out of difficult times and situations and have a hard time even saying thank you? If our organizational structure causes our interest to stop at our individual property lines, we create gaps for our community and we create opportunities for people not to get care or not to engage in a healthier lifestyle. So collectively, can we organize ourselves in such a way that we're obsessed with closing gaps? We see everybody as worthy of our interest.
We do see that everyone is worthy of our interests.
So sorry. There we go.
And it's good because it's really our why. Simon Sinek, the author, often says, do you know your why? We're crystal clear about our why. Not only are we a faith-based organization, we are what I call a faith-led and faith-inspired organization. So Steve, I'm going to pause there and maybe we have a little dialogue about that as we look at the next slide. But it is our opportunity to be faith-led in our work.
Sure. Yeah, no, and I love that, Judy. And I think this is what makes Adventist Health, unique, really. I mean, there are other faith-based health organizations out there as well that do good work in this area. But I love the fact that Adventist Health is faith-based, and we're looking at this as more than just. It's not a money-making thing. It's not a merely something where we're trying to help people's health, but we again, it's that whole person care, which I think is beautiful. So, and Judy, you haven't gotten into this yet. I know you're going to probably here in the next little bit, but tell me a little bit more about how where Adventist Health is, because you mentioned like East LA and you mentioned some of these places where, these rural, I don't know if, talk a little bit about where some of your clinics are at, because my observation as an outsider to, Adventist Health, if you will, is that you folks do a lot of work in places where some other groups don't go. And, I've seen you, help out struggling clinics or hospitals and come in and say, you know what, we're gonna take over here so that you guys can continue, your work in this community. So tell us a little bit about some of that, working for the underserved, if you will.
Harry referenced it in his video as
Yeah.
we serve hundreds of communities on the West Coast. So our hospitals reach from the Dalles in Oregon to the coast in Oregon and the city of Portland. And then as we get into California, Northern California, all the way down to White, Glendale, and Simi, the entire state of California. We happen to be the largest rural health provider in the entire state of California. We have gone to communities where others have chosen not to, because we are committed to do all that we can to help keep healthcare local. We're also in Hawaii doing amazing work there on the island of Oahu. In each of the communities that we serve, we're doing this in the hardest, most challenging time in the history of healthcare.
Why do you say that?
Well, the work that you are watching happen right now in Congress, Steve, you and I spend a great deal of our time with our congressional members, both state and federal. And so right now, at this very moment in time, there's a lot hanging in the brink of treating the most vulnerable in the country with access to care. What will that mean for us in the future? Time will tell, but right now, we know that as reimbursements continue to decline, as access to care continues to be extremely challenging for people in all of the communities that we mentioned, whether those are farming communities in Central California, those communities that feed the entire nation, whether it's in a rural community like Willits, California, which is where the redwoods begin, whether that happens to be on the Central Coast of California or in East LA, where our hospitals of Montebello and White are, where the most challenged, the most vulnerable, those communities that are in desperate need are looking for access to care. So Adventist Health is here, committed to do excellence, to live our mission in probably the most challenging of times, as reimbursements dip, as the cost for providing health care continues to escalate, as supplies to do that are at the highest they have ever been. You said it earlier, hospitals do not do what we do because of the bottom line. We do it at Adventist Health because it's our sacred calling. It's our mission. It's doing the right thing for those communities we serve. And it's not just about what happens in the hospital. I will say this over and over. It's about what happens in our communities. You're seeing here that 80% of health outcomes are really determined by what happens through the environmental, behavioral, and socioeconomic factors. We call those our social determinants of health. Only 20% of healthcare can be attributed to direct medical care. So our community needs benefit work that we do, it's to address that 80% of the needs of our communities. And we do that in a way that I think is very, very impactful. For example, here you're seeing it done through mobile showers. Now I've got to talk about the clever ways that we come together with our communities. We ask our communities in our communities needs assessment. We say, what are your greatest needs? In many of these communities, both rural and urban, they talk about access to housing. They talk about transportation. They talk about access to healthy foods. Those are like the basics, right? They talk about the need for hygiene. If you can't afford a place to live, you're not going to have access to water. to take a
Mm.
shower.
Hmm.
You're not going to be able to access clean water for those basic needs that you have.
Right.
So in our community of Clear Lake, we partnered with those that really wanted to make a difference, and we said this is relational. It's not transactional. It's relational. So let's meet their needs where they are, where the rubber meets the road, and we are looking at holistic ways of caring for their needs. And so this is a mobile shower, and it literally goes throughout Lake County for those that don't have access to affordable housing and they need to take a shower. These might be people who are living in tents or campers. These might be people who are living in homeless shelters. And we
And
believe
Judy,
this is one way of caring for them.
I love this, and I want to just connect this back to the mission of Jesus, briefly here, because some people might be saying, well, wait a minute, I mean, this is, um, how does this connect with Jesus? Well, look at what Jesus did. He went around and he was healing diseases, right? The blind, those who were lame. And by the way, these were considered the outcasts of society oftentimes in his day, because the religious leaders at that time taught that their physical ailments were judgments of God, maybe. But he goes out and he ministers to these folks that are struggling to just basically get by and meet the uh, minimum necessities of life. And I see that's what you folks are doing here too. This is really the ministry to the least of these that Jesus talks about in Matthew chapter 25, right? Um,
Absolutely.
yeah,
Absolutely. I think of the Good Samaritan. How many
mm,
people passed by
right.
the person on the side of the road and did nothing? Um, so for us, it's like this is the opportunity. This is faith in action.
Sure. And
This is
this goes beyond the hospital doors. You're out there in the community. Yeah.
we're in the community. I'll tell you a couple other stories. If I moved over from Lake County to Mendocino County, I think of Jeremy Malin. Jeremy is a person that gives not only all of his clinical expertise as just a brilliant nurse, but also someone that says, I'm going to take my God-given gifts and do something to transform the way care is delivered in communities. So he puts a backpack on and goes into sometimes homeless camps. Sometimes it might be our tribal centers. His first thing he's doing there is developing trust,
Hmm.
is creating that opportunity to be in relationship, to just be there and listen, to be there and hear their stories, to be there as a sounding board.
Hmm.
And as he does that, he's able to then also in that backpack are things that will help care for that person who might not be able to get to the hospital for a need, or who may be afraid culturally of being next to a traditional caregiver.
Hmm. Hmm.
And he's able to have that conversation, the relationship, and then sees their need both emotionally, physically, socially, and spiritually. And he is that good Samaritan at the side of the road.
I love it.
Every single month he's doing this. And so if you ever have a chance to meet Jeremy Malin, you want to hear him tell his story. I think of the community impacts that are happening that then prevent those individuals from coming into an emergency department.
Hmm.
Those are sometimes the frequent users of an emergency department because their needs are not being met anywhere else. And so we're in the trenches with them, doing that work where we say, let's just learn about who you are as a human being.
Hmm.
We're interested in you. We see you. We hear you. Back to Eric Stevens' point, knowing that person is the first step. And then we take it to the actionable measures of what can we do to transform your life. In Portland, Oregon, Terry Johnson, who oversees the chaplaincy services, but also government affairs for the
Mhm.
city of Portland. In fact, I think he's the chaplain for the city of Portland.
Oh, neat.
Terry is involved in everything from community gardens to working with meal deliveries through a $1.7 million grant from the Trillium Community Health Plan and through Meals on Wheels. We have been able to serve thousands of people in need of food. These
Mm,
might be seniors. These might be the aging population who cannot get to a grocery store.
yeah.
Um, in the summers in Portland, they do food stands, and just right across from the hospital, they donated land for this very ethnically diverse population to grow produce that is meaningful to them. And so while some of the farmers have land in Damascus, Oregon, where they sell their produce, sometimes they don't have enough to feed their own families
Hmm.
or the type of foods. And so the hospital donated land and said, please plant your gardens here and feed your families.
So a community garden, essentially, or at
It's a
least leasing out, or letting people use the land to grow their own.
Exactly. Let's make sure that you have access to good, healthy foods, and we'll help make sure that that's a reality. Food drives, more than 748 pounds of food were collected last year at their Thanksgiving celebration and given to the local food bank.
Hmm.
Um, this they do this every year, and these are just some of the ways, in addition to what we're seeing here with mobile showers in Los Angeles. I love what they do at the White and what we do at Glendale and Montebello, but there's a program that they do that's called the Welcome Baby Program,
Mm.
and it's taking care of the needs, both prenatal and and postnatal for families. This means that families who are just trying to figure out, how do I bring life into this world? What are the
Hmm.
things that I need to do when I don't have transportation, when I'm not sure that I have secure housing, when I'm trying to just get sleep at night as parents of a newborn? What are the things that we need to do to address the mental health of individuals who are just, bringing life into this world? And what we learned was that 1 in 3 families had moderate to severe mental health needs who were in the Welcome Baby program.
Mm.
We found that 80% of needs were social. So that included nutrition and housing versus the 20% that we talked about, which is traditional health care.
Hmm.
97% of 9-month-olds receive timely, essential care as a result of this program that they do at the White. And 100% received extra resources such as safety kits and home improvement support. So, you say, what does that have to do with a hospital delivering care? Well, that's the
We're
kind of stuff we do.
Yeah, it's back to that whole person care, and you're not just treating in the hospital. You're saying we want to actually help people beyond that. And I look at some of this, Judy, because you mentioned the unhoused folks, for example, who might come in to the emergency room, right? Because they don't really have ongoing health care otherwise, and a lot of them are living. Maybe they're addicted to substances or whatever the situation is, but um, I look at some of the work you're doing as preventative. You're really trying to make it better for them so they don't have to come to the ER or end up in the hospital. And that is, it's interesting how you look at, and I want to talk about this when we're, kind of through with what you want to present here, because I have a couple questions on this. But you look back to the Adventist kind of mindset at the beginning of the Adventist healthcare, movement. And a lot of it was about prevention, right? There was the healing of those who were sick, but also, hey, here's what you can do to avoid getting sick. And so I think that really does fit in with kind of our heritage, if you will, as Adventists. And I see a lot of other healthcare organizations realizing, hey, that's the way of the future, right? Helping people avoid the hospital if they can.
That's absolutely right. Absolutely. The next slide tells you that we begin that journey very early. In fact, there was research that showed tobacco use begins at the 4th grade level.
Wow.
So we have said our focus on kids is because we want to talk about what it looks like to live a healthy life,
I love
to
it.
bring joy into their lives, to bring
Yeah.
meaning and purpose in their lives. And so that work of, tobacco prevention to abstaining from alcohol, that's something that we begin at the grade school level in the communities that we serve. And we partner with organizations like the Blue Zones to create healthy communities. We do this with our churches. We do this with our community partners, with cities, with schools. It takes all of us together. But for us, it's bringing joy into their lives at this very early age to say, you've got such a wonderful life ahead of you. We're here to be your friends. We're here to care about your needs, and we're here to fill you with the potential that God has given you to bring that into action. That next slide, Steve, actually, as you talk about prevention. So here is Dr. Steve Herbert at Adventist Health St. Helena. As we look at our history of Adventist healthcare, the sanitariums did just what you were talking about. We were here with doing everything from a healthy lifestyle, from making healthy food choices, talking about exercise, talking about, hydrotherapy and massage. Steve Herbert and his team take this to our communities, to the streets, as we call it, through our mobile health van. They're here to talk about serving the most vulnerable and beyond, to make sure that we not only are doing things like cooking classes, and we're providing every week, there's a long table of food in a community that Dr. Herbert serves, where you just come to the table and you break bread together and you have conversation and you're in community together. That for us also is what doing justice in the world looks like.
Absolutely. No, I like that.
And then we do something called food as medicine. We believe wholeheartedly that food is medicine. And an example is what happens at Adventist Health Howard Memorial, which is, again, in Willits, Northern California, very rural Northern California. But here's a beautiful garden. It's provided by the foundation. It actually is across the street from the hospital. Gardens are planted, and then the food is harvested and shared with the community. The food is harvested and it's used in the dining area of the hospital, and the whole community comes. That's one of their favorite restaurants in the entire town.
Seriously.
To get a really great meal, because it's literally farm to table dining, and it's happening at the hospital.
Wow. I gotta go check that out.
You come check it out. It's the most delicious food. And then the patients who are in the hospital also benefit from it. But, we said, why not be that catalyst for showing people how to live healthy lives? And so there are other things that could be done with the land. We've chosen to use it to meet the most important needs of the communities we serve. The next slide tells you a little bit about the investment that we do.
Mhm.
So over $1 billion is invested in our communities to do the right thing.
Mhm.
This is what it means to take care of the communities. And in a time of scarcity across this country for healthcare, for hospitals, we have said we will do all that we possibly can
Mhm.
to care for those who are entrusted to our care. Will this be able to continue as reimbursements change? I don't know the answer to that.
Mhm.
I know that we every day will lean into this to our best abilities with God's grace and do what we can to serve every community.
Judy, I want to interrupt and ask you if it's okay, because we're talking about funding, and I want to kind of bring up a, I don't know, talking point I've heard from some folks, and that is, well, why is healthcare, or and maybe specifically Adventist healthcare in general, so dependent on government funds? And so here we are now, and some of those funds are being cut. It seems like. Where does that leave us? So I guess, it's interesting. I'm looking at this slide here and I'm thinking, man, you folks are doing, in other words, when it says unfunded Medicaid, unfunded Medicare, that means you're essentially donating those services, that amount of services to the community, meaning that whatever you're getting from the government isn't really covering the work you're doing, number one, right? So who would be affected if Adventist Health, let's say, refused to take government funding? Let's just start with that question.
The majority
Yeah.
of each of the communities that we serve, and we're talking about 70% of each of the communities we serve, Steve,
Sure.
represent individuals who rely on Medicaid and Medicare. 70%.
So essentially, you wouldn't really be able to serve people except for maybe wealthy people who could pay out of pocket, or people who have private insurance that can afford these things. It would really limit Adventist Health from being able to serve those who are poor, indigent, whatever. If you were to say, no, we're not going to take government funding because we might become dependent and whatever, because that's one of the criticisms I've heard, and it seems like, well, it really would limit you, right?
We are called to serve all.
Sure.
And if 70% of the communities we serve rely on Medicaid and Medicare government funding for their care, we would be what I would call cherry picking
Yeah.
if we're only serving those that have insurance. Goes back to, what does social justice mean?
Mm-hmm.
Right? It goes back to serving all, regardless of who that person must be. And it goes back to the most vulnerable in our communities. So if we're talking hands and feet of Jesus kind of work, that's what it looks like. It means we are in the most critical time in our entire history of delivering healthcare. And we're doing it because we believe that it's the right thing to do. But at some point, you have to say, how do you keep your doors open, right? Just recently, 3 hospitals in the state of California have talked about the fact that they are having to close their doors.
Wow.
40% of hospitals in the state of Oregon are up for sale.
40%.
40%. This is not because people don't want to do the right thing. It's
Mm-hmm.
because doing so becomes harder and harder when there isn't the support to do it. But we're here filled with hope because we're saying we have been so blessed to serve people who entrust us with their care.
Mm-hmm.
And we will continue to do that. The next slide will show you a little bit about those people who are part of our board. These will be familiar faces to your listeners. These are individuals who grapple with this as we all do on a daily basis. And I'm thankful for the Dr. Woodsons of the world and John Friedman and the whole group that you see here. They come alongside our executive team, which is the next slide. And we lean into what does whole person care look like in a changing world where living God's love is our sacred calling. The next slide tells you that we are living Mark 9:35. Jesus called the 12 and said, anyone who wants to be first must be the very last and the servant of all. And so the servant leadership work that we do is also replicated through Matthew 25:40. The next slide does talk about what that means for our work. And the king will reply, truly, I tell you, whatever you did for one of the least of these brothers and sisters of mine, you did it for me.
Boy, that really brings it home. We're going to go back to this view here. But I love that, Judy. Thank you for sharing that overview of the work you're doing. You know, a lot of it beyond the doors and the walls of the hospital itself. And it takes us back to that, you know, question of why are we doing this, right? The why. And it's because of who we are, who God has called us to be, right? Let me ask, can I ask you a couple more questions here before we wrap it up here today? This has been fun to just hear and learn more. Let's talk for a minute about how Adventists, and I'm going to ask you to put on your historian cap if you have one for a minute, Judy. How did we Adventists get involved in the healthcare work to begin with? And, you know, in what ways has that mission changed or stayed the same, you know, as we have now entered into the time that we're living in now?
Well, when we go back and look at the work that began with Kellogg, right?
Harvey Kellogg, yeah, right.
And that spread, but that was the vision that happened there. And as I look at, you know, what Ellen White called us to do, and certainly her presence on the West Coast, in places like our sanitariums, this was historically the work of looking at how do we transform care through all of those epidemics that happened through you and I recently listened to a presentation as we talked about the history of some of those major social determinants of health that began hundreds of years ago. And where the world has come, we've come a long ways. And yet sometimes we pause and say, but have we?
Right.
In addressing it, we have knowledge, and I think knowledge is power. But it's only powerful if you put it into action.
Sure.
And so as we've seen technology advance, as we've seen the human spirit continue to evolve, we're grappling with some exciting opportunities to do so. Steve, your takeaways from that recent presentation that we heard on the history of epidemics and pandemics that covered this nation.
Yeah, no, and are you talking about the thing we had over at the conference office with?
Yes.
Yeah, no, I think it's and how Adventists were really involved in making the world a better place, right? And I think, and so in that way, the mission has stayed the same, right? And whatever different types of you know, situations we're facing in society, we're called to be salt, to be light, and to be the hands and feet of Jesus. I love that. I think that you know, one thing that I've noticed, and I mentioned this at the beginning, when I go in to meet with lawmakers and their staff, and I mention Adventist Health, again, the response is overwhelmingly positive. They appreciate the work that you folks are doing in the clinics and the hospitals in their districts and so on and so forth. And how do you perceive the work of Adventist Health being viewed by the wider public? I mean, what kind of feedback are you getting?
We are grateful and humbled to be serving in the communities that we are.
Mm-hmm.
And we do so through a collaboration and a partnership where we're coming together. And this is not just Adventist Health coming in and saying, here's what we're going to do. This is Adventist Health listening to the needs of the community, listening to the voices of those that said, if you're going to be in our community, we'd like to do this together. And that resonates tremendously with us.
Yeah.
It is the opportunity for us to look at not only their physical needs, but again, their emotional and their spiritual needs. I call it the hands and feet of Jesus work. That is what we do every single day.
Yeah.
And it's the ability to transform lives. The impact that our presence has with somebody is because we take the time to be at their side, whether it's at their bedside or whether it's at the side of their home or whether it's meeting them on a street. We're still at their side.
I love that.
Bringing hope and healing.
Yeah. Well, Judy, this has been fun. Thank you for this conversation. And I think for those who are watching, hopefully it's helped them to understand a little bit more about Adventist Health. And I'm hoping this could be a good resource when I, meet with government officials as well. I can say, hey, by the way, if you want to know more, watch this. And because I think, again, really good work that you folks are doing. I'd like to kind of just wrap this up with something practical, a takeaway that those who watch this may be able to use to make the world a better place themselves. So Judy, why don't you tell us what's one thing that we can do today, as we log off here or finish up this video to make the world a better place right now? Something we as individuals can do. I've loved the stories of, I think, the nurse you mentioned who was out there with his backpack and he's out with the homeless, but just a word of wisdom, perhaps, to those who are watching.
God has given us hands, feet, eyes, and ears. All of us that can lean into being His love.
Mm-hmm.
And so I think all of us have the ability to do that wherever we are in the world. And whatever we see as an opportunity to use His grace and His love in an unconditional way to meet the needs of someone else, to get away from being the belly button gazers of looking at our own needs and focusing on the needs of someone else and being in community with them. It all begins with the relationship. It all begins with the relationship. So to just lean in with love, concern, compassion, empathy, I think that's something that all of us can do. And in doing so, we are then moved to action.
That is a good final word. Thanks again, Judy. Thanks for doing this. And those of you who are watching, we hope you've learned something about Adventist Health and that you can take something away from this conversation that you can go and make this world a better place. God bless you today and have a good rest of your afternoon.
Thank you.